alaikum warahmatullah. This is Abid and I'm a specialist in sports. Today we'll be studying different type of meniscal strains and normally how we'll take decision to treat patients, whether it's conservatively or send back them for the surgery, or sometimes patients send to you from the surgical part of and they say they want it to be done conservatively. So there are different decisions to be taken before you send anybody to any surgical consultation. Before that, we should know different types of meniscal strains and how we should read an MRI, normal appearance of MRI, and there are different types of meniscal strains. And normally the patient is sent for 6 weeks after a meniscal injury, and the patient is treated conservatively within 6 weeks, and if the patient gets alright within 6 weeks, then they will continue with the conservative management. If they are still having a problem and they cannot bend or flex, they cannot bend or straight the knee, then they will be sent for the surgical consultation and all. There are different decisions to be taken before any patient is sent back to the surgical consultation. You need to know that a patient should be 20 years old and an athlete, and then the surgical part should be done as soon as possible. And if the patient is aged after 40 years, you need to think that whether you go for a surgical or the research has been found that sometimes the surgical intervention is not that much effective than the conservative management. So the next part will be showing you the different videos, general study. It's for the study purpose only, and different types of the meniscal strains and all. Thank you. Okay, so I'll be showing you T2 sagittal view. So normally when you have this is a meniscus, this is the femur bone, this is tibia, and these are meniscus. So I'll be confined to the meniscus only. So this is the anterior horn, this is the posterior horn. When meniscus, both you will find them at the same length, they have the same size, so it's most likely the lateral meniscus. To confirm this thing, we can go slightly back and you see the fibular bone here. Fine. So this is the anterior horn and the posterior horn of lateral meniscus. We didn't find any signal there, so we'll continue against it. This is T2. Then we will find once you go through the video, you'll find the anterior cruciate ligament. It's intact, there's no discontinuity, there's no signal there, so you will continue. And now you will have the posterior cruciate ligament, so we'll be crossing to the medial side now. There's the medial side, your medial meniscus, so it will always differentiate between the anterior, because the posterior horn of medial meniscus is bigger than the anterior horn of the medial meniscus. Okay, so here in medial meniscus you find some signals. You find this triangular part, as you can see it's a tear, or you can say it's so this is the meniscal strain. It's a longitudinal strain, and so the next video of the same patient is a coronal view. So we'll be going through a coronal view now. When you go through a coronal view, so this is the fibula, so this is the lateral side. So you have two triangles. This is the lateral meniscus and this is the medial meniscus. Normally, sometime you will find in a patient that this part is absent. Okay. So and this part is there. So in that case, it's a buccal handle tear, because this part sometimes goes inside the joint space, and so you find this type of findings. So here also you can find the longitudinal tear, but it's at the periphery. So this is the longitudinal tear at the periphery. And this is the axial view. So you can see here, posterior horn of medial meniscus. This is medial meniscus. And come here, this is the fibular bone, this is the lateral meniscus. So we have to see here. So this is the posterior horn of medial meniscus. Next, I'll be showing you different type of tears. Now you look into this tear. First of all, this is the medial meniscus, because the posterior horn is bigger than the anterior horn. And see, this is the horizontal tear. It divides the meniscus into the upper and lower segments. Normally this tear heals itself, so conservative management. I'll show you the other tear. This is the other view. Same horizontal tear. Okay. The upper and lower part. Okay. Now, what you are seeing is the, you see here. Look at here. Okay. This is a vertical tear, but it's long. When you see in an MRI, it will be like a longitudinal tear. Okay, so it's a vertical longitudinal tear. Okay. Now, if you see the same thing here, so the longitudinal tears are the tears where the tear is parallel to the meniscus. This is meniscus, and the tear is parallel. So it's the longitudinal tear. Okay. Sometimes when the longitudinal tear is small, it can be healed conservatively, or if it's more towards the periphery and more towards the red zone. This is the red zone of meniscus. This is the white zone of meniscus. So in that scenario, also the meniscus can heal. You can opt for conservative management. Next, what you see, this is called as a radial tear. Okay. So radial tear always comes from inside out. Yani when you see from here, see like here. So this is the inside of the meniscus. So it's from inside to the out. This is called as a radial tear. So this is how it will be seen in an MRI findings. Fine. The next. Okay. See what you see here is this is the beak. You see when you go through an axial wave, this is a beak. It looks like a parrot beak. So whenever there is a parrot beak appearance, it's an oblique tear. Okay, next what you see is here, see? This is a vertical tear but in oblique direction. So this is how the parrot beak appearance comes. This is how the oblique tear goes. Same like a radial tear, but it's like in oblique direction. Fine. And the next, see, you'll see the longitudinal tear here because the vertical again, and it's slightly messy, so it's a longitudinal tear, and it's on the peripheral side, so it's most likely it can be healed. And now see the dangerous one. This is the complex tear. 1, 2, 3. It normally happens whenever there is like some degenerative change, or this is the, see, you can see a lot of tears here, a lot of small triangles here within the meniscus. So it's called complex tear. You cannot repair it. It's because it's already broken down. Either you have to remove it or you just keep it there. It normally happens with the degenerative mucoid meniscus and all degenerative things. Okay, now the next, what we know is a buckle handle tear. In buckle handle tear, you will see this meniscus. There's a longitudinal tear, but the inside of the meniscus is pulled towards the center. So they create this type of gap there, same like a handle. So it's a bucket handle tear. It's a longitudinal big tear. And sometimes this tear, it enters into the joint. So what you are seeing is it's a root tear. Now go next. So this is again the root tear. The meniscus is moved outside, or meniscus moved inside. Next, this is a flap tear. See, so how you will see this flap tear in MRI? So you will see the other segments here. See, sometimes this flap enters into the joint, and you make a sound. It may lock the joint. You will have momentary locking and all. Okay. Next, so again you will see the same flap tear. The meniscus tear from here and flap tear. Next, this is a radial tear, but a big radial tear. I'll show you because see, it's a radial tear, but a big radial tear. See now, It's inside out. Full meniscus is cut in two pieces. That's how you will see the different types of tears. And in this, you can see there is one thing. This type of buckle handle tear. See, this part is there, and there's no meniscal part here. It's gone somewhere. Okay, so this is a buckle handle tear. Okay, but I'll show you the other photo of this one. See, now it's repaired back. They had got it back. You see again. I'll go back again. There's no meniscal tissue here, right? See here. Now they repaired back this buckle handle, and you can see meniscal tissue here. So this is how we see different types of tears. Okay. Again, this is a horizontal tear.